Everyone, and welcome to today's webinar, Healthcare AI Certification Program, an introduction. All lines are muted to prevent any background noise. If you have not already downloaded the presentation, it is available in PDF format by clicking on the document icon at the top of the page. We recommend you download the presentation prior to the end of the webinar. We will have a question and answer period at the end of the presentation. You can access the question and answer feature by clicking on the text box icon at the top of the page. We will not utilize the chat feature, so please do not submit any entries. This webinar is being recorded, and the recording of the webinar and the handout will be placed in the webinar archive section of your CIHQ or ARS websites within a couple of business days. It is now my pleasure to turn the conference over to Rick Curtis. Rick, you have the floor.
Thank you, Deb. Well, good morning or good afternoon, depending on your respective time zone. I'm Rick Curtis, Chief Cook and Bottle Washer with the Center for Improvement in Healthcare Quality, and it's my pleasure to welcome you to what I think is a great and very special program that we are kicking off. It is the nation's first Healthcare AI Certification Program for hospitals by a CMS deemed status accreditor. And we're very excited to share this information with you. I think you're going to find this both fascinating and value added. I am joined today, little click here. There we go. I'm joined today by our partner organization, Analytics, and the Chief Executive Officer, Vishal Bala, and the Chief Operating Officer, Noel Zamat, who are going to be here and working with us to explain this program. Let me give you a little bit of background as to how this came to be. Vish and I met about 8 or 9 months ago now, I think it was, at our annual accreditation summit in San Antonio. And we were sitting during the afternoon and just kind of chatting about life in general and healthcare challenges. And we got on the subject of artificial intelligence and how it's impacting the industry, what is the challenges that we're facing, the potential growth, all that sort of stuff. And in that discussion, we sort of came to realize that from a regulatory governance oversight standpoint, there's nothing out there to help us, to guide us, to make sure that how we're utilizing artificial intelligence is being done safely and appropriately, and without anybody kind of leading that from a regulatory standpoint. Hospitals are, quite frankly, kind of left to their own devices. And that's where we came up with the idea of developing a certification program that hospitals could use to establish the framework within their institutions to make sure that how they approach AI and use AI results in safe care, appropriate controls, and appropriate governance and oversight. So basically, our companies got together and we took advantage of our strengths. At CIHQ, we're used to writing standards, developing certification programs, assuring that those processes, those procedures are rigorous enough to pass government muster. Being a recognized deeming authority, we have the legitimacy in the eyes of CMS, for example, and state agencies, that the things we do are developed appropriately and measured appropriately. And then Analytics, Vish and Noel's company, basically they're experts in data analysis and data management and in artificial intelligence and using AI as a way of furthering people's success in those arenas. So we put the partnership together so that each of us will take advantage of our respective strengths. So this certification program, essentially from CIHQ's end, is going to be administering it, developing and approving the policies, the procedures, the standards, and actually issuing the certification and being the certificate of record. Analytics is developing and giving us the expertise in developing the standards around artificial intelligence, understanding the critical nuances, how we need to approach this to be able to do it appropriately for healthcare. And they will actually conduct the certification assessment itself, since they have the technical expertise to do so. So that's the role of the two entities, and we're going to kind of tag team this webinar as we go through it. We'll be handing off to each other to explain different parts and pieces. All right, so what are we going to cover today? Basically, talk about the problem or the challenge with AI in healthcare, why governance and having an oversight model is absolutely critical, an overview of what our program entails, the standards, process, describe and show you how preparing for this certification not only will enable you to have something that you can say to the public and your payer sources, et cetera, that yes, we've got our hands on this, but it also helps you prepare, we firmly believe, for the day comes that the government issues and starts to set up the regulatory arena, that hospitals that go through this process will be the best prepared to enter into that and be successful at the outset. So where are we today? Well, quite honestly, and no offense to anybody out there, but unless you have been living under a rock, AI is not only coming, it's already here, and it's well embedded already in healthcare. That growth has been exponential. 10 years ago, if you had talked about artificial healthcare in accreditation or certification or CMS or hospitals, et cetera, people would have looked at you and first said, well, what's artificial healthcare? Nowadays, you can't get away from it. It's completely taken over our lives. It's in almost every industry, and ours is no different. The fact that it's already in and being used in our hospitals makes it highly susceptible to flaws and failure and being problematic without the necessary oversight and regulatory barriers. So the use of AI is far outstripped where CMSs, HHSs, state agencies, the folks that play with us and kind of keep us in line. There are no safeguards currently that are formally through the regulatory environment. Basically, it's the Wild West, and the sheriff hasn't shown up yet. So you know what happens in the old Wild West when there was no sheriff in town, things can get a little weird. So Vish, Noel, I'll turn it over to you.
Yeah, thank you, Rick. Good day, ladies and gentlemen. This is the tension that healthcare leaders are living with. Patients, they want healthcare. They want healthcare to feel more like Amazon or Netflix, simple access, faster answers, easier navigation, and better support. Organizations, they want AI to reduce burden, improve efficiency, show progress, but healthcare cannot move like retail. We know that, right? Privacy, safety, this thing called hallucinations, trust, they all matter. Meanwhile, vendors are moving fast. Some are new vendors, some are existing vendors that are adding AI features into what they're already offering your organizations. So AI is entering from every direction. There's also bring your own AI that may be sanctioned or unsanctioned, right? So AI is entering from every direction: patients, leaders, employees, vendors. And regulation is still forming. Of course, we have NIST and we have the ISO framework, you have GDPR and so on and so forth, PDPL, DPD, and I can keep going on. But regulations for us specifically is still forming, us being healthcare. But accountability is already here, right? And that is why governance is now an organizational duty now, not a future project, because accountability is already here. Next slide, please.
Hello, everybody. My name is Noel. I'm the COO for Chief Operating Officer for Analytics. If you think AI is complicated, just wait till you look at the governance and policy standards. I think at last count, we counted 14 that may apply to a hospital. And right now, they're not integrated. So if you try to incorporate some of these tools into your operation, you must abide by many, many policies, and it's up to you to actually integrate them. Sounds bad? It gets worse. If anything bad happens, the fault is not with the policy maker. It's at the end, that responsibility is going to fall upon the organization that's implementing these standards. So we find ourselves in a really interesting situation where there's this massive tension, like Vish and Rick were talking about, to incorporate these technologies. There's no lack of guidance, but there's really not a lot of clarity or cohesiveness to that guidance. And that at the end is what we're trying to fix. There's no single framework to bring this together, and people have to figure it out on their own. That's what we'd like to fix. Before I step off and give it off to the next slide, let me tell you something. You are not alone. My background, actually, and a lot of the work that I still do, is actually in AI and military aviation. I'm a retired colonel in the Air Force, combat vet, flew some test, and I still am asked to advise on how the military should evaluate these very complex systems that go into military aircraft and other systems. And they are dealing with exactly the same problem that we're talking about here. The technology is far outpacing the ethics and the governance and the standards under which those tools must be operated. And not many people are taking the step back and saying, okay, I don't need another chatbot that's as smart as 20 PhDs. I just need somebody, an agent, a tool to do the job safely, ethically, and efficiently. And that's what we're trying to do. Next slide.
No, thank you for your service again.
Thanks.
It's an honor really to collaborate on these things, on this very meaningful opportunity. So, I'm sure you're all aware of the messy case regarding sepsis. In that example, a widely deployed predictive model was later shown to perform poorly, and it had negative outcomes, right? I come from the casino business many moons ago, and a negative outcome over there is very different. Risks are high, but different risks, and here risks are different. In healthcare, of course. And then I'm sure you're aware of the other incident, which is there's an allegation that an AI supported process helped limit post-acute care without enough individualized review. So different examples, there are many such examples. Different examples, same lessons, right? When AI affects care, coverage, or trust, informal oversight is not enough. You got to have rigorous oversight, and it's even better if you have a third party helping you that have a rigorous process and are helping many organizations. So if we see something in one organization, then we can help elevate that matter. So AI needs clear ownership, human review, monitoring, escalation, and accountability. And the slide that Noel just showed previously shows the complexity. The other thing is governance has to be proportionate, right? And we'll talk a little bit more about that, but an organization which is a 30-employee freestanding center in rural Georgia can't have the same level of governance, it's not proportionate to, let's say, a multinational healthcare organization. So the issue here, ladies and gentlemen, is no longer whether AI is being used. We know it is, sanctioned or unsanctioned. The issue is whether it's being governed safely, rigorously, and consistently. Thank you. Next slide, please.
So I just want to share, thank you both. Another quick example before I get to this. There was a study, there's a health system that uses AI in its call centers. So if a patient calls their center and asks, I have these symptoms, should I go to the ER or should I not? And AI is basically, this health system put AI, remove most human interaction from the loop. And there was a study done, and they found that they took some expert clinicians and they gave the same questions to the clinician that they did to the AI model. And on the bookends, both the clinician, the human factor, and the AI model were consistent. If a patient said, I'm having chest pain, should I go to the ER? Both AI and the humans said, yes, get to the ER. Conversely, if someone called and said, I got a hangnail, should I go to the ER? Both said, no, I think you could probably stay home. What they found fascinating was in the middle of that spectrum, about 40% of the time, there was a disagreement between human expert clinicians and what AI was advising the patient, either to go to the ER or to stay home. And it's a classic example of where AI can get into an organization, be used, but not have the appropriate governance and control that would have helped that health system identify up front that they had potential issues with the accuracy of their AI model, and they could have stopped that at the outset versus finding out down the line. So as Vish mentioned, we can probably spend an hour talking about the challenges and all the oopsies that we're seeing. We are starting to see, though, what I call the cavalry coming into action. If you look at the feds and the different agencies, more and more, and you can see the list on the slide, they are starting to build regulatory oversight into what they're doing and the people that are affected by it. Individual states are starting to craft legislation and regulation around how hospitals use AI. So we're seeing more and more the government starting to establish those controls. But what's fascinating is we're not seeing that out of CMS yet. We're not seeing it out of the major factors that govern healthcare. And that's concerning. Now, I'll guarantee you that is in the works, and it will be on the way. It's going to come to a theater near us pretty soon. The question is going to be, though, where does it come in? Does it come in through the conditions of participation? Does it come in through the payment regs? Does it come in by a whole new initiative? In one sense, it doesn't really matter, because once it hits, and this is the key, once it hits, that body of regulation will be based on the same industry guidance that these other entities have used to base their regulations. And that set of guidance, and Vish and Noel will talk about this in a minute, but that set of guidance is exactly what we have used to develop this certification program. And that's where the linkage will become so important. By the time the regulations do hit, they're going to be based on the very things that this certification program will have asked of you and helped you prepare for. And that will make the gap much, much less onerous than someone who's all of a sudden faced with those regulations and hasn't looked at the challenge through those prisms. So basically, from our perspective, really the bottom line question we would ask organizations to ask themselves is, if I was to come and use AI, would you say that I could trust the use of AI in your organization? That if my doctor was using AI to help determine clinical treatments, or you were using AI for operational efficiencies or that sort of thing, could you honestly sit there and say, I have complete trust that we're using AI effectively? I think most of us, if we're honest, are going to say not yet. All of us will be in various stages of that journey, but I don't think any of us could honestly say that we're completely there, simply because there's no body to actually govern, to get your arms around. How can you say you're there when there is no there? And that's where we feel that we can help you with the solution, and that's the certification program. So I'm going to turn this over back to Noel and Vish, and can kind of walk us through what that program entails.
Go ahead, Noel.
So, thanks, Rick. At the simplest level, what we're trying to do is allow you, we're not certifying tools, we're not checking to see if your vendors are doing the right thing. We're really enabling your organization to make those decisions on your own. or your organization to have its own governance system to actually conform to these best practices that we have put together based on that very deep analysis of that entire corpus of documentation and policy that Rick mentioned earlier. That is where the world is moving to. And we have crafted a set of criteria that distill those into an easily implementable governance structure throughout your organization. That allows you, we're not what's the analog? We're not teaching you, giving you a fish. In a way, we're not even teaching you how to fish. What we're doing is setting the conditions so you can have your own system of teaching people how to fish. We'll help you build the oversight. We'll help you build the governance. We'll help you build the structure. And from that point on, now your organization, no matter if it's a tool that you are looking for now, or a strategy that you develop, or a strategy to pursue AI throughout your organization, you will be prepared and will have in place the internal guardrails and expertise to make that happen. Next slide.
Thank you, Noel. Thank you. So here's what I would say. The organizations themselves are morphing. The AI tools that you're using will be increasing over a period of time. The tools themselves will evolve, and the regulations will evolve. So in this much change, how do we enable organizations to proportionately govern AI? So like Noel said, we help you create the framework and then manage the framework to the standards. We've taken from all the standards you saw on Noel's first slide, the complicated one, we've taken the fundamentals from NIST and ISO and so on and so forth, and distill them. So what we do not do, though, just to reiterate, we do not certify a specific AI tool, a specific AI model, or algorithm, or clinical outcome, right? What it does assess is whether the organization has structured governance in place. Do you have good habits with oversight, policies, processes, and so on? Next slide, please. So this slide is important because we are taking direction from recognized AI, privacy, healthcare, and international governance frameworks. And we're translating that complexity into something the healthcare organization can actually operationalize to your context, utilizing the CIHQ certification rigor. This is not a theory or a generic AI checklist. When you join us, you will see it is a healthcare governance model informed by these recognized frameworks, the NIST, including EU AI Act, GDPR. So we're bringing in the rigor from all these, the standards from all these, and leveraging CIHQ. So the goal, essentially, ladies and gentlemen, is not to make you chase every framework separately. It is to give your organization a practical, healthcare-specific governance path that is aligned with international recognized standards for your context. Next slide, please. So we have taken all of that and with Rick's and his team's help, brought it down to 15 standards. And each standard has several requirements, again, depending on your context. Next slide, please. And so, as you will see, as I had mentioned before, different organizations are at different starting points and their contexts are different. So a large academic health system or a community hospital or a small specialty provider will all need different governance, and their maturity and complexity will differ, right? So we built a framework that allows the organization to build from a minimum responsible foundation forward, right? You start with the core and you build to level 1 and level 2 as is applicable, so that you get optimal practices. So in spirit of support, we will also be providing access to an AI support resource, which you will see soon, a small demo of, that can help guide teams through the standards and expectations. Next slide, please. So I have to take a step back, and in my previous life, in my previous career, I had the pleasure of working with several different deeming bodies, as Rick mentioned. One thing I genuinely appreciated about working with CIHQ, which is why we're here today, partnering with them also, is that the process that CIHQ utilizes is very supportive and improvement oriented, right? It's not a gotcha exercise. The organizations, how does the process work? Basically, the organization, you start by submitting an application. So CIHQ can understand the scope, complexity, and maturity. And then you have a education session where we level set expectations. We provide the context and the walkthrough of your self-assessment. Then we share the self-assessment tool, which actually walks you through what's needed for self-assessment. And after that, you have the validation survey. And if you've done any kind of, especially a CHQ, I had the pleasure and opportunity of accompanying surveyors on safety and quality surveys. So I've been on the receiving side of the surveys as well in healthcare, like I mentioned. So it's the same process fundamentally, right? The perspective of the surveyors, the perspective and the angle with which the mindset, the cultural orientation of CHQ really makes a difference. I think their rigor and their constructive culture together, along with this expertise we're able to provide, and we will work on together, because this is not fully baked, right? We know new models and new tools are coming out every day, so we need to make sure we're on top of it. And this will help the organizations improve and stay up to date with maintaining their standards. Next slide, please.
Okay. Thank you, Vish. Thank you, Noel. So basically, what happens is once the assessment process is done, you've applied, you've gone through your self-assessment and education. That self-assessment is used to come on and validate and survey on site or virtually the implementation of the standards, etc. Then you are certified. Now there's two levels to the certification, and it ties in with what Vish was talking about the journey and maturity in terms of your AI governance. Most hospitals, when you take a look at those standards, you take a look at those requirements, there are going to be some that you're going to look at and go, okay, we can do this. That's not too big a gap. And there may be some that you look at and you go, I'm not even sure I understand what that means. Can you help me with this? And we recognize that everyone's on that journey, which is why the requirements are tiered in terms of their complexity. So as Vish mentioned, with those core requirements, which an organization should be able to meet with some ease or so, basically, if you meet those core requirements, or you have an acceptable plan of correction to fix them within 30 days, then you would get a provisional certification. And then over the course of 90 to 180 days, 3 to 6 months, you would work on the requirements you may have some outstanding issues with, either level 1 or level 2, and have acceptable plans of correction implemented within those timeframes. So basically, after 6 months, you progress through all 3 levels of any requirements, and then you would be granted full certification. And so that certification then is good for a period of 36 months. After the 36 months, then you would undergo another assessment. That's kind of a traditional triennial cycle that we're all used to. On an annual basis, we would ask that the CEO of the facility simply submit an attestation that we will craft for you that basically says that during that period of time, you've maintained your compliance, if there were any significant material issues, that this is what occurred, this is what you did about them, etc. And then there would be the formal recertification, going through that process again, like I said, about every 36 months. Guys.
Thank you, Rick. Yeah, it's a rigorous process. And as there are changes, we will be sending updates, of course. The value proposition, this is where, certification moves from risk management to real organizational value. First is the risk and accountability, where healthcare organizations, as we mentioned, we're already accountable for AI decisions, whether formally govern them or not. So certification gives leaders independent validation, third party independent validation that the governance is structured, it's active, and it's defensible. Secondly, operations and execution. So the real test is not whether governance exists on paper, right? I always say we live and die based on the first level of leadership, right? How does it show up in daily workflow? This program helps AI governance from policy to practice, practical application, contextual, proportionate governance, while reducing dependence on few individuals holding critical knowledge. So if you understand what is required, then you're more likely to be able to adhere to those standards. Thirdly, strategy and growth. So AI is not slowing down anytime. We know that. It's exponential, as Noel would do in his F-16. Organizations need confidence that they can adopt AI responsibly. You have to be confident, right? How do you separate the fool's gold from the real gold when you're seeing all these tools out there? How do you scale it safely? Because there's nothing wrong. It's an awesome tool. You can make a juicy steak or you can burn a house down with fire. You just need to know how to use it properly, right? So you need to scale it safely and adjust as new tools and regulations emerge. So the value proposition is simple: independent validation, confident leadership, and trusted AI. So that, ladies and gentlemen, is what this certificate is designed to deliver. No? Oh, sorry,
So,
Rick.
yeah, I think we're gonna switch presenters here. Analytics has developed a really slick product that is going to be part of this certification process that you can use to actually use AI to help you prepare for an AI certification. And they've been nice enough to kind of share what that tool looks like. So I think, Noel, you have the screen now. I'll turn it over to you.
Excellent. Can you hear me, and can everybody see the screen?
Yes.
Awesome.
Yep.
So this is a very simple tool that basically codifies everything we've been talking about here in a simple to use way, right? And as humans, there's a lot of complexity, but like we say in analytics, complexity into insights. So what? What is this? What does all this corpus of information and standards and international standards mean to us? And we tried to make it easy for both the hospital and the surveying team to actually answer some questions. So this is a tool we developed, and let's just start off with a hospital. If you have no idea where to start, just say, how can you help me? And the tool will provide that information. By the way, if it looks like it's going slow, it's because this is not going out into the internet and asking for recipes for cranberry sauce or what have you. It looks a lot like ChatGPT or any other LLM you have, but it's really focused specifically on this use case at hand, which is how do we set up a system for AI governance? And one of the things you can ask here is, so what's my first step? First step to crafting an AI governance organization. And it gives you the standard, which you will have. So it points you to where you need to go to any one of the standards that you have. In this case, creating a formal AI governance committee. It talks to you about who needs to be on there, what other people need to go in, what a clean charter looks like, all of that information. I can go deeper. Can you give me more information? You provide more information on AI, and I'm going to put it actually here, 1.b, right? Because we have that in there. And it tells you who needs to be in on the team. So you can go as deep down as you can on this, and it'll help you craft your framework. But let's say you also have another challenge, right? So all of a sudden you find that one of your physicians is dictating clinical notes into his personal phone on a commercial AI system. So one of our clinicians used his personal phone with a commercial AI agent tool to capture clinical notes. Should I be worried? And yes, this requires immediate action. This scenario triggers multiple compliance issues. It tells you GDPR, A17, the criteria. You need to report that to CIHQ, et cetera, et cetera. It tells you what the immediate actions are. So we envision this as a tool that will frankly grow with you, right? Because some of the feedback that we get from the user will be incorporated in this. By the way, if you elect to use one of these tools, we will actually work with you to incorporate whatever information, private information about your organization you want into this tool. That information will be protected and only accessible to your team. So this is not going to live out in the internet somewhere so everybody can access it. It'll be protected, and therefore you can use this tool along with the specific information from your organization to essentially improve your operation or manage it as you go through. Let's just go now to see how it would help the teams who are actually helping you with certification. By the way, it's pretty simple here. You can switch role. I can go back to the role picker and say, hey, let's go to a surveyor and say, how can you help me improve hospital operations? How can you help me? Hospital governance. AI governance. That should be a gimme because that's what we do. And this is, again, what's important about this is that we're not going to measure you with a different yardstick than the one we give you. We are all working on this together. The tool just has different roles. One is focused more on implementation of these standards and policies and best practices, and the other one is focused on the oversight of those or helping somebody achieve those. For example, we found out that a safety representative was using a commercial LLM for sentiment analysis. Is this an issue? Right. So this is something that they may find out during an inspection or a certification, and it tells you this is potentially a significant finding. All right, and it walks you through what you need to find out. It asks you a couple of questions. Was this incorporated in the inventory? Right. So if you actually had taken these steps, then it's a different issue, and we can walk through this. It tells you what standards might be impacted, so we are able as evaluators go in and say, hey, take a look at the standard AI10 or AI14 and go ahead and read that and see if there's something you can do here. There's some scoring considerations based on those levels that Rick was talking about. And then ask some questions, from a critical standpoint. Is the hospital aware? Was this an issue that they have actually gone through all the compliance, but they just haven't properly documented it? These are the types of things that we need to address. That number 2 one there are the critical questions, sort of opens it up. And we designed this tool this way. What else is out there? If somebody in safety is using non-approved AI for sentiment analysis. Do we know if there are others? If so, that may point to policy issues. So this is not meant to be some onerous, gotcha type of thing like Bish was talking about earlier. It's really meant to help the surveying team use the same tools that the organization will use, but also make sure that we cover all the gaps. If you're interested in this at all, please contact Rick after this webinar. We'd love to hear your thoughts on this, give you a little shot about this. And like Rick mentioned, if you are interested in this type of certification, this is the type of support that you can expect from us. Thanks.
Thank you.
Give it back to you.
Okay, Deb, can you just make me the presenter again?
I think we're in.
And there we are. Okay. Let's get back to this. All right. So the question everybody asks, how much is this going to cost? And the answer is not straightforward. I'm going to be very transparent and upfront with you. Most of our certifications are fixed in price. There's some adjustments sometimes for special, unique situations. This particular certification, we tossed around, the three of us, quite a while about how do we approach a cost structure, and basically came to the conclusion that because a particular hospital or system's degree of AI penetration, where is it? And its maturity, how sophisticated, how much is it being used, etc. When you couple that with the natural scope and complexity of a hospital, made trying to put a cost out almost impossible, because there's just so many variables that come into play. So the way this is set up is you would submit your application. We analyze that, we contact you, we make sure we're understanding very clearly the scope and complexity both of your hospital as well as your AI use and penetration. And then we would make up basically a custom quote for you. And we'd say, look, based on what the information we have, in order for us to do this reasonably well, et cetera, this is what it would cost you. And then it's obviously your call as to whether you would like to proceed. So fees will be done kind of on a case-by-case basis. If you are interested, as Noel mentioned, next steps, if you would like to pursue this, get a little more information, yada, yada, email me at rcurtis@cihq.org. We'll get it. We'll send you an application. Right now, it's a PDF. It's pretty simple. All of this will be online in the near future, but we're starting small. So you send me, we get the application. We would give you a quote. If you find that acceptable, then we would ask that we have some non-disclosure and HIPAA business associate agreement signed. Obviously, it is likely that we will be accessing proprietary data in your organization, and you would be accessing proprietary stuff in our organizations. So having that mutual NDA to protect our respective confidentiality and obviously HIPAA compliance would be necessary. We would send you the invoice. Once the invoice is paid, we would start the assessment process that Vish talked about. So it's a pretty straightforward process. And we're hoping that we'll get some industry interest in this, and would love to have you be one of the first to become certified nationally in this new field, and you'll get all the bragging rights. So I think that's about it. Vish or Noel, do you have any questions before we open it up to the audience, or anything to say?
I'm good.
Go.
If I may just leave with one thing, is do not wait until you become the headline to build the habits to keep you out of it, right? AI governance is like a seatbelt. Noel always says that, right? You do not wait for an accident to decide you need a seatbelt. This program is built on established frameworks, real world experience of CIHQ and their team, and of course Noel in defense, and me a little bit in healthcare. We are focused on practical, proportionate, and usable uh, system, right? So if this resonates, join us. Look forward to this. Thank you, Rick. Thank you for the opportunity. Noel, again, great to partner with you. Thank you for your service.
This is great. I'll actually pull on that thread one last little bit since you set me up. I have to, just beat on this dead horse. You are not alone. Other organizations, many other verticals are struggling with exactly the same thing. I think what's different about this and the reason why we are super excited to partner with Rick is that he saw the value in this and said, yep, this is a problem that we need to fix now, instead of worrying until, like Vish said, it's a headline. That has not been the same in other disciplines and verticals that I'm involved with AI. So I'm super excited to be able to actually put something out there that can make meaningful impact to organizations who are really trying to stay above water and trying to do the very best for their patient population on a clinical and experience basis. This is our contribution to help you do that. So thanks.
So thank you, guys. Deb, do we have any questions? And I don't remember if we told folks how to submit a question.
Yes, thank you, gentlemen. You can access the question and answer feature by clicking on the text box at the top of your screen. If you've not already done so, please download the presentation. We are open for questions. If you have anything, go ahead up to the text box and type your questions.
We'll give them a minute to get some questions in.
As they're doing that, once again, Rick, do you mind sharing the slide of how people can contact you? That would be amazing. Yeah.
Yep, pretty straightforward.
Thank you.
May take a minute for questions to come in.
Yeah, and another thing is Noel showed you one of the few tools we have. We have a few other tools as we're waiting that help you, so that if you're a smaller organization, you don't have to necessarily build your own. And those are not, you don't have to use these tools, but they're there for you to help you through the process. And even if you're a 30-employee health organization, you need to use AI. It's going to help you tremendously, but let's just allow us to help you to make sure it's done with the necessary guardrails.
Any questions, Deb?
No, there's no questions. Oh, we do have one. Should we even seek to get involved with third-party vendors used by our current EMR prior to getting certified?
I did not understand.
Should we even seek to get involved with third-party vendors used by our current EMR prior to get certification?
Yeah, I think the question that's being asked is the hospital's not certified, but yet there are third-party vendors that are promoting AI products and systems. And the question from the hospital is, should we go forward and start embracing this and bringing it into our organization, or should we hold off until we went through a process that certification would be designed to assure we had the appropriate governance and oversight structures?
I can start providing an answer on that. I think it would be, this is going to sound self-defeating, but bear with me for a moment. in the spirit of we're not telling you what to do, we're trying to help you do it better. I think it would be outside of our scope and really our responsibility to tell hospital, no, don't have this conversation with somebody and don't incorporate that. Those business decisions at the end of the day belong to the organization, and rightly so. What we're trying to do is make sure that those decisions are made in the best way possible, taking care of us understanding all of the risk and making sure that they comport with a dynamic set of policies out there. What is the right answer? I would say that if you are looking at AI tools to improve your patient outcomes or improve your patient experience, go do it. Have a great time. I would strongly urge you to call Rick soon after that and say, listen, we are taking steps towards incorporating these technologies into our process, but we want to do it appropriately. And we will be more than happy to help you do that. This is akin to, I don't know, I would say running with scissors, but that's really inappropriate, right? Every person is free to do what they want within the law. There's no law that says you cannot do that. But there are risks of it being done incorrectly, especially when people need to make a buck. And I will finish by telling you a story. Vishal and I started analytics by looking at actually developing exactly those tools. And very soon we realized that the market was moving so quickly that corners were being cut. And we could not safely, effectively, and ethically meet the market demands without cutting corners. And that's when we decided, no, we're not going to do this. And that's when we realized that the real issue is not coming up with another LLM that's smarter than 25 PhDs. We just need to make sure that the one LLM that's about as smart as an intern actually does things right and ethically. And that's why we're here in this call instead of trying to craft an app that goes on your iPhone and promises to do magic. So there are a lot of vendors out there. We were one of them. The issue is not whether those things can be deployed, incorporated into your organization. The real question is, can it be done effectively? And are there risks to your patients that you do not know about by incorporating these tools? If you are worried about those risks, those unknown unknowns, then give Rick a call and we'd be happy to help.
I just add one thing to that. Noel and Vish mentioned this earlier. AI is already in there. You may not have gotten the vendor, you may not have got thing in your EMR, but I guarantee you, your doctors, your nurses are walking around every day on their phone, pulling up Google AI or Chat GPT or anything else that's just out there and getting answers and taking in a sense, direction from it. So at least if you brought in a commercial vendor, there's some assurance that some safeguards have been put in place, but it's not going to be the same as you having a system set up. But if I had to choose a rock and a hard place, I'd say you're better off to go forward than simply relying on your clinicians to do Lord knows what with the tools they have. So that's how I'd answer. Any other questions, Dan? Oh, I'm sorry.
Well, I would say also to that specific question from that specific organization is the sooner you sign up or connect with Rick, you'll at least have a guideline, a set of rules are not rules, what standards, sorry, that you could utilize in terms of your vetting process, right? So we're here to help in any which way we can. We're not here to knock down AI. AI is amazing when used appropriately. We're here to support you utilize that to the best of your ability and the product's ability. So don't stop, but just do it responsibly.
Okay, thank you.
Other questions?
Yes. What is the difference between your product and a HIPAA compliant AI chat box?
That's a
Want a
so
handful?
yeah. So
So
we're
go
yeah.
ahead,
Go
Mike.
ahead. So first off, we don't have a product like a HIPAA compliant chatbot. Uh, the what we offer is really a way for your organization to know that if somebody comes up and says, I have a HIPAA compliant chatbot, that you have the tools so you can actually peek behind the curtain and see if that is truly a HIPAA compliant chatbot or if it's just a bunch of hot air. So we're not building anything. We're going to help you with a couple of tools, generative tools or whatever it is to help you craft that. But we're not building anything. What we're crafting is we're doing is help you build the ability for your organization to make those decisions on your own.
If I may pull on that a little bit further. So I may be misreading this, but my perception is you're thinking that the tool that Noel showed is the product. That's not the product. Our product is actually uh, a combination of various rules and regulations from around the world to make it a 15 standard uh, with 15 standards with several requirements as the guideline. And we help you ensure that you are managing uh, AI, you're governing AI properly in line with those standards and the requirements. What Noel showed was a tool that you can use when stuck or when you need some further information or you need a quick reference. So instead of going through the guide, uh, you can actually utilize this tool. That was an example. And we have many other tools. Thank you. I hope
So
that
yeah,
answered.
let me see if this helps as well. So this was a slide. We went through it pretty quickly, but if you look at these are the titles of the standards. So these are sort of the title lines, and then there's the actual, like we do with all of our programs. There's the standard, then there's the requirements. But if you look at the subject matter of those 15 standards, it basically takes you from A to Z in terms of establishing, implementing, monitoring, and evaluating how AI is used in the organization. So let's say you took that chat box that someone's talking about, and you would say, have we got the right oversight to make sure that we take that into our organization and process it in a systematic manner? Are we looking at whether this complies to law and regulation, as that changes almost from day to day? Uh, is this product consistent with standards in the industry? Has the vendor said to us, here are our safeguards, this is how we have designed this? Does it meet our needs? Do we have to, is this something that is necessary for us or a nice versus need to do? Are our staff ready to handle it? Do they have the knowledge and the ability to take that tool and use it appropriately? What training do we need to provide to the staff? If something happened, how do we recognize it? How do we report it? And how do we mitigate the damage or the risk? Are we using this in patient care? And if so, how do we approach the consent process, informing patients, making sure that human decision making remains the final arbiter, that you're not depending solely on AI to drive the decisions around care? How do we bring it in? How do we make sure that we recognize it's in our organization and where it is, monitor it? Someday we decide we don't want this anymore. The newest thing has come out. How do we retire this and make sure that it truly is outside and no longer being used in the organization? What are we doing to make sure that we're trying to improve how we do this on an ongoing basis? And then what's the governance relationship between us and this vendor that wants us to use our product? How are we collaborating with each other to make sure that that product's being used safely? And if we are into research at all or some advanced analytics, how are we making sure that that product or system is being used? So that's how this whole program is. You take what you want to do and then you subject it to the oversight and governance structures. And the analogy I will give you is simply this. If you take emergency preparedness, you're all in hospitals, you should recognize this. There's this concept called an all hazards plan. And it's designed to say we don't really know what's going to hit us, but we've got a structure in place that regardless of what hits us, we have a way to respond to it. And there's some things we know ahead of time are likely to hit us, and we have special response planners for that. But the all hazards plan basically says we're not sure where it's going to happen, but we have a structure to respond. In a sense, this is kind of like an all hazards approach to AI. With everything that's going on, there will be things that will come up, issues, tools, etc. And going through a structured process will enable you to respond to that and manage it effectively. So that's kind of how the program would work with the type of question that was posed. I hope that makes sense.
Thank you, Rick.
Sorry, long-winded. Go ahead, Deb.
We recently implemented a new EMR that does not have AI capabilities. Additionally, we are in the initial development of our policies and procedures related to AI. Is this the right time to contact you, or do we wait until we have an existing structure in place and then contact you to see if we are in compliance with the standards?
Go ahead, Noel. Looks like
Yeah, I would. I'm
Okay.
chomping a bit. Early is better than late, right? I think the right answer would be call now. Call Rick, and we will figure out a way to make sure that we work with you, not as you didn't do it right, or some sort of arbiter or whack-a-mole or what have you, but really a partner in helping you craft those policies correctly. This is the dream, right? This is the what everybody wants. Hey, we're about to develop this. Can you help me build the ship from the beginning instead of having to go after a lot of people have put in a lot of work into crafting this policy and saying, hey, did you consider this? So I think that the right answer is the sooner the better. If you have yet to deploy AI in your organization, but it looks like you will, so there is that clarity of thought and that collective wisdom in the organization that understand that this is something important that needs some quality time needs to be spent on it. That is perfect. So most definitely give us a call.
Yeah, this is the ideal case scenario. And
Yep,
with this,
absolutely.
you're going to leapfrog many people who have already implemented AI. You are going to leapfrog many organizations because you're going to start with the best habits.
I agree. Deb, anything else?
No, gentlemen, there are no more questions in the queue. If you do have any further questions, please feel free to email Rick Curtis at rcurtis@cihq.org. Any closing comments?
No, just thank you so much for listening. Vish, Noel, thank you for being
Thanks.
here with me. And we will look forward to answering any further questions you might have. We appreciate your time. Go forth. Have a great day. Thank you.
Thank you.
Thanks a lot.